Alright, we'll see if this actually works. Alrighty, here we go. Hi, my name is Sutherland Ingle, and I'm going to be presenting to you today about thermotherapy, also known as hot pack therapy. I originally was planning on doing an entire presentation on hot pack therapy, but sadly there's not enough information for me to fill an entire 30 minutes worth of chatter about moist hot pack therapy. So I decided that I would expand my area of study into the entirety of thermotherapy. I've chosen thermotherapy due to the amount of swimming that I have done in my life. I've been swimming for 11 years, and the constant aches and pains are really hard to deal with, and you just get tired of sitting with ice on your shoulders, so you say, I'm already cold from being out of the pool. Let's jump in a warm bath, or put something warm on. Maybe that'll make me feel a little bit better. So, let's get stuck into this. I think some introductions are definitely in order here. What is this thing that we call a hot pack or thermotherapy? A hot pack is typically something that is a bag full of silica, and they are typically stored in hot water. Obviously, because they're moist hot packs. The bags are typically made of canvas to help insulate the silica inside of them, and when we apply them to the patient, we will always remove them from the hot water and wrap them in a terry cloth or other insulators to protect the patients from burns. You'll note at the bottom of the screen I have placed a specific degree of temperature, a specific degree temperature for the water, which is important because it helps the packs keep from growing microbes and other things that we would rather probably not have in our on our bags here. After these bags have been used, they are placed back into the warm water baths to reheat and to kill the bacteria that may have begun to grow while they were outside. Thermotherapy has three main types, according to the article Physiological Basis for Thermotherapy. They are conduction, convection, and conversion. So we're going to start with conduction, as you can see here. Some examples of that would be a hydrocorrelator pack, a low-level heat wrap, and a paraffin bath. A low-level heat wrap is pretty much the same thing as a moist hot pack. It's just dry. And it's a wrap instead of a pack. Some indications of conduction would definitely be delayed onset muscle soreness, which I am very, very familiar with myself, and menstrual pain. These things are easily taken care of with heat and massages, but we're not talking about massage. That's for a topic for another day. Heat increases blood flow by way of vasodilation, and it lets the body know that something's wrong and that needs to be flushed out. Some contraindications of this might be diabetes, MS, rheumatoid disease, and spinal injuries. Diabetes and MS because here they are associated with circulatory problems, and they may not be able to correctly flush out the body or interpret the signals that their body has been sending them. A rheumatoid disease, since it is caused by inflammation, the heat will increase the inflammatory response as a result, spreading the disease further through the body and increasing the metabolizing rate. Spinal injuries due to the excess heat can cause problems with nerves, so let's not go there. Some adverse treatment effects of a conduction modality can be burns. According to tips for heat therapy, that article states that lying on hot packs will increase the probability of burns due to decreased space between the patient and the hot pack. So advise your patients not to lay on their hot packs. Moving on to convection. No, not your convection oven, although cookies does sound really good right about now. Just like heat constantly moves around in that oven, we are constantly moving water here in this case with fluido and hydrotherapy. Wound debridement isn't a perfect example of an indication for this because we would like to have water constantly moving so that we do not contract an infection in this specific wound, such as a burn or a deep and open flesh wound. This past fall break, when I was in Connersville for Thanksgiving, I went with my cousin. She was on call that weekend, and we had to go into surgery, and she had to perform a debridement on an open wrist fracture, which I thought was really cool. So I got to see that firsthand. Infections are only a problem here as an adverse effect because water, that water cannot be standing still. It needs to be continuously moving. Not to mention we are using warm water here, so bacteria is always into play. Now let's move on to conversion. Conversion, obviously, meaning converting one source of energy into another, here in the form of ultrasound, diathermy, and heat lamps. In diathermy and heat lamps, we are converting electrical energy into heat energy, and ultrasound, we are also converting it into heat energy, but we're also going through a different mode of transformation here. Some indications of conversion would definitely be tendonitis and osteoarthritis, as well as joint contractures, muscle spasms, and, as I mentioned before, osteoarthritis. Something to notice is so far I have mentioned both kinds of arthritis, osteo and rheumatoid. Rheumatoid arthritis is an inflammatory disease, whereas osteoarthritis is just the bone disease. So, as mentioned before, inflammatory responses are heightened by heat, which is why typically a contraindication for a modality is rheumatoid arthritis, and osteoarthritis is typically an indication because with osteoarthritis we cannot spread that. It's already just there. So some contraindications of this might be pregnancy and anesthetic areas for obvious reasons, because the patient may not be able to feel correctly what is happening, and they may not be able to tell you that the modality is too hot or causing them pain or is burning them. So let's stay away from that. Pregnancy is also another big one because the waves and amount of heat and energy that is generated can cause problems depending on the modality that we are using. I remember I believe it was diathermy we were talking about in class, talking about the treatment radius that it has, and that can be harmful because there's not a space in your body that is far enough away from your uterus to keep it from radiating that way, and that can cause complications with birth and all sorts of other birth defects. So let's not even get into that. Let's move on to how this thing called hot pack even works. So yes, you put it in certain places, and it does things like you put it in places of injury, and it does things like increase blood flow, increase cell metabolism, relax your muscles, and bring oxygen and nutrients to your areas. Increase blood flow to the point of contact. This can cause redness. This only becomes a problem if the patient complains of pain, or if the patient complains of pain. Increased cell metabolism is what causes and aids in tissue healing. We also want to wait 12 to 72 hours post-injury to apply heat, because we are increasing cell metabolism, and we might metabolize things that we do not intend to metabolize, causing more complications and harm than we do good. Bringing oxygen and nutrients ties into increased blood flow and cell metabolism. All of these can be good because they aid in healing, but they can be bad if we do not wait 72 hours until all of the other proteins that are trying to rebuild this tissue have vacated the area. Bringing nutrients into the tissue that isn't ready to receive them is not going to do it any good. Not to mention the excess heat that we are applying can damage all of the new tissue growth that is happening, and that is not something that we would like to do, especially if we're trying to rehab the patient. We're not trying to destroy them anymore. So how does this thing even really work? The physics behind it all. First, something you want to keep in mind is that you want to check your patient's vitals before you begin the treatment. You'll want to check to see if there are any lesions or problems with the skin before, or if they have had any problems with diabetes or MS, you want to make sure you have a good patient history. Always want to be sure that there is enough insulation between the patient and the modality to prevent any burns or problems with application. The skin should be clean and dry before applying in case of any trying to think of the word. I can't think of the word. Any interference with the application. All right, now on to the physics. According to temporal changes in pain and sensory threshold, the optimum time we want to leave the modality on, as stated here, is 20 to 30 minutes at a time, no longer. If the modality has been kept at the proper temperature when not being used, the modality will reach 1 to 2 centimeters deep into the skin, radiating the heat, and it can be applied every 30 minutes for up to 1 to 6 hours. From 1 to up to 6 hours. Though there's a point where we are unsure whether the application will do any more good to the body, or if the body will eventually reach a certain point and it will not take the heat anymore. The body needs to be protected, especially since the modality deals with heat. Proper precautions need to be taken, always checking every 3 to 5 minutes, or roughly around then, on the patient with the temperature of the modality, and checking and rechecking the signs and symptoms of heat, illness, or anything else that needs to be done that can improve treatment. According to a study done with young teens who had terrible PMS, applying heat to the sacroiliac joint greatly decreases cramps. This is due to vasodilation. When heat is applied to the area, it also expands into the capillaries, which then allows the autonomic nervous system to try to recalibrate itself, which is relieving the pain. Essentially, the heat wakes up the body and says, hey, there's something wrong here, we need to fix this, and it gives it a jump start into regaining its homeostatic ways. A study from 1946 showed that a moistened heat pack or towel achieved a target heat faster than a dry pack due to the contact with the skin. Oh, you told me not to use it then. Okay. Contraindications, here we go. So, as you can see here, I have listed acute conditions, peripheral vascular disease, impaired circulation, and poor thermal regulation. You most definitely want to have an accurate patient history, as I mentioned earlier, to ensure that the injury is out of the acute phase longer than 72 hours, only due to we want to make sure that they have had enough time to clear those proteins themselves so that the patient can already has a basis of what we are trying to go ahead and continue increasing the metabolization on those proteins. This modality is also a no-go if the patient has an elevated temperature. The last thing you want to do is cause them to go into shock or overheat. Diabetes is usually associated with poor circulation, as mentioned down here, impaired circulation. That means the main reason you'll want to avoid that is because they won't be able to circulate the heat and it could cause burns down there. Avoid infected areas or areas of inflammation because the heat just produces the perfect environment for microbes and things like that to sprout and take over. Not to mention, it will increase the inflammatory response. All right. So when do I use this thing? To reiterate, as I mentioned earlier with all three of the different types of thermotherapy, we want to use this in subacute, so after we've already passed the acute phase, or chronic inflammatory conditions. We want to reduce subacute chronic pain, subacute muscle spasms, range of motion, because those muscles are tight and bound down. We need to fix that. Since heat relates to muscles and decreases spasms, patients then are able to progress their range of motions easier. I have on here joint contractures. Joint contractures are normally seen in patients with cerebral palsy. that are hypertonic contraction of the muscle around a joint, and it just makes it really hard for them to move. So that will kind of goes along with decreased range of motion. It will just loosen those muscles up and decrease the tension there. So how do I know when it's healed? If the patient has presented with an acute injury or has presented with an injury and they have not been and it has been less than 72 hours, I wouldn't even go there after a crucial point in tissue injury cycle. The modality can freely be used 12 to 72 hours post-acute injury. It is open season. You're allowed to use any of these heat. Do not use before or it could cause increased injury or may even result in death. I'm just kidding. It didn't result in death. I don't hope so. That'd be bad. This modality, you said how much this modality costs? I didn't really say, but we're about to find out. So there was a research study done in the United Kingdom. There were 323 subjects total of in total. 112 of them were given the moist heat wrap. The others were given either ibuprofen. 103 were given ibuprofen, and 118 were given another medication. The cost efficiency was determined by only the people who showed improvement that were polled afterwards. Total cost ended up being lowest with the heat packs at $27.77 each. Ibuprofen or the other medication, paracetamol was in at $32.04, and ibuprofen was last at $36.04. The monetary values are calculated in pounds. I don't know why I said dollars. That was my bad. The hot packs also had a higher satisfaction rate by day 4 over the other modalities. The hot packs then would lead to net savings of resources in the UK, which I thought was really interesting. All right, so there's my sources. Overall, I truly believe in the use of therapeutic moist hot packs because to me they're obviously warming, but I feel as though they give you a sense of security, and the heat to me just makes you feel good. It makes the pain go away. It makes me feel like there's a warm hug. I feel like the cold just kind of like makes you feel bad, and like it just makes you feel even worse about yourself because you have to sit out. You're already cold. So all in all, I'd rather use a therapeutic hot pack, I guess, unless I was. Well, I would have until I know now that you're not supposed to use them 12 to 72 hours after your acute injury. But say, Levy, thanks for listening.